Hello, my name is Alicia Cecil, and I am going to be doing my final on video. So, for the step-by-step synopsis of my thinking on each Morrison step and how I arrived at my diagnosis, excuse me, my client was Jenna S. And for Morrison step one, I gathered information. She was a client that was referred by her supervisor for the appointment. Um, she's a 37-year-old Caucasian female with no spiritual preferences, and she is also in a long-term relationship. She is a graduate student in the engineering department. Her family history includes that her mother has a history of depression. Jenna reported having a good relationship with her family, including her three brothers. She reported no medical history, no surgeries, no suicidal ideation, no medications, and no substance use. For this step, I followed the outline of gathering information on the intake note on the therapy note software. For Morrison step two, my thinking was to ask about current and past symptoms. Jenna reported not being interested in doing activities with her friends or her partner. She reported feeling like she is a failure and unable to do anything right. She reported not sleeping well due to worrying and feelings of sadness. She said she has a strong fear of failure and feels like she struggles with wanting to be perfect at everything. She also said that she felt so worried she was going to mess up because she had failed at a project and was just worried that she was going to fail another one. My thinking on Morrison step three was that based on the symptoms that were reported, no substance use involvement, I am thinking probable diagnosis could be major depressive disorder, other specified depressive disorder, or an adjustment disorder. So for Morrison step four, for safety and urgency, I did not feel like there was any immediate concerns regarding Jenna. She did not report any feelings of hurting herself or anyone else, and she did not have a history of those thoughts or feelings. For Morrison step five, using the DSM criteria and looking at all the different diagnosis to eliminate alternative thinking or probable diagnosis that I was thinking, she met criteria for adjustment disorder with mixed anxiety and depressed mood. She reported feeling anxious and really only feeling depressed and anxious since August when school started. So for Morrison step six, the diagnosis that I chose was adjustment disorder with mixed anxiety and depressed mood. I feel confident in that diagnosis and that it is the least restrictive diagnosis to start. For Morrison step seven, we completed a PHQ-9 and a GAD, generalized anxiety disorder scale. And on the PHQ-9, she met criteria for moderately severe depression. The total score was 15 out of 19. And on the GAD-7, it was a total score of 0 to 4, minimal anxiety. So she did ask about medications and asked if I could prescribe them, but I told her that was not in my specialty, was not providing medications, that I could make a referral to a medication provider so that she could speak to someone else about that. I also recommended that she do biweekly therapy. She made the comment that she does better in person. And so with that being said, I recommended that she attend biweekly therapy in person. And if she wanted to go to weekly therapy, we could arrange that on my schedule, or we could work around her school schedule. Also, For Morrison Step 8, I completed the intake note. I also completed the rating scales in her chart and made sure that it was documented clearly, and went over the fact that because we were on telehealth, we needed consent. So the feedback that Jenna had given me was that she felt like I did pretty good, but I had to meet with her twice. So the first time I met with her, it was 13 minutes on the intake. And she said for billing purposes, I needed to draw that out longer, which, like I said, I was going through the note and just asking the questions on the note. And I understand the billing side of it. So I understood that feedback. And she also suggested that I send the Zoom link the day before we're meeting or that morning, because certain clients will kind of have anxiety if they don't have the meeting link ahead of time for their appointments. And then how I will address my areas for growth in my placement. So I actually have never done an intake before, and I am planning on observing as many intakes as I can in my practicum placement so that I am fully prepared and able to be successful at completing intakes. And also I want to ask questions about treatment plan goals and ASAM scoring. And then my plan for the area of growth with the Zoom link is on my appointment card. I want to have my link on the appointment card so that I can give it to the client when I give them their next appointment. And if they have never met with me before, then I plan to send the link out the day before the appointment and also the morning of. Yeah, so thank you so much for listening. Have a good day.